Record.
Hi, this is Jen, and I'm going to be starting my assignment 11. The first thing I'm going to be doing is showing you how to place and remove a surface barrier. But first you need to wash your hands. Now, when putting on a surface barrier, you got to find which one's the best that's going to fit. I'm going to be doing a surface barrier on a chair. So you need to fit it onto the chair properly. Make sure all surfaces are covered. Make sure the headrest is covered. Like that. And when you remove it and it's contaminated, you need to put on all your safety wear. So you need to put on your mask. Nope, I have it on backwards. Your goggles. And your utility gloves to remove contaminated materials. When you remove it, you need to pull it up inside out if possible. Roll it up and throw it away in your normal waste container. When you're done, you need to wash your hands again. You need to carefully take off all your stuff. You need to wash and disinfect your utility gloves. And then wash your hands again. Now we will be pre-cleaning and pre-treating a room. You need to wear the same protective clothing along with your utility gloves. You can use spray disinfectant or white disinfectant. If you use spray disinfectant, you must make sure you leave it on the chair for the proper amount of time before you wipe it off, and after you wipe it, it needs to sit for a little bit. If you're just using cloth disinfectants, you just need to make sure you wipe every aspect of the chair where a patient will be seated, touching, or you would come in contact with. When you are done disinfecting your stuff, you need to repeat the same steps of washing your hands and washing your utility gloves. The next step we are going to be doing is operating an ultrasonic cleaner. You need to have all the same equipment on again. I know, but I don't want to do this. And for today, this is my ultrasonic cleaner. And what you do is you got to make sure you have the proper amount of cleaning liquids inside the instrument. And then you need to put your container, your tools in that you are going to be washing. And turn it on for a cycle of 15 to 20 minutes. A buzzer will sound when it is done. After the cycle is done, you need to remove the instruments and rinse them with water.
Why don't you just do it for real?
And lay them out to dry. The next item of cleaning today, not on, that's okay, is autoclaving. When you are autoclaving, you're wearing the same protective clothing again. And what you need to do is, your tools are probably clean already. But you always got to pretend that they are contaminated. And when they are contaminated, you need to dip them in a corrosion solution. Sit down. Yes, I have ready. You got to use it already. And then you need to insert them into a package. These gloves are huge. I can't open up. You close it, and you insert it into your autoclave, which today is my microwave. Set the autoclaver for the appropriate temperature and time, and turn it on. At the end of the cycle, the steam is going to be very hot. You need to remove it with a hot pad.
Did you really turn the microwave on?
No, it's pretend. And then you remove the instruments from the sealed bag, and you place the sealed caps on the tray for the next patient. The next thing is sterilizing the dental handpiece, which today, this is my dental handpiece. It is my child's tooth, but we can use it. You only need normal gloves on for this procedure, just to make sure your hands are not touching the equipment. Before you remove this, you need to wipe the visible debris away from the mouthpiece. When you remove it, there's different instructions. You might have to just dip it into solution. It might have to be steam sterilized, or ultrasonic cleaning. We are just going to use spray disinfectant today. And you got to clean it. Take off the hose. You need to make sure you blow all excess liquid out as you are cleaning it. Reinsert it. You might need to lubricate it if it doesn't fit inside the mouthpiece properly. And then you just take a cotton swab with alcohol and you clean the top of it. And that is the end of assignment 11.